Bismillahirrahmanirrahim. Assalamu alaikum, dear students. Welcome to your channel, The Anatomy Canvas. In today's class, we are going to discuss with the MCQs on reproductive system. So the first MCQ over here is that the ovarian artery originates from the abdominal aorta at the level of the first lumbar vertebra, the second lumbar vertebra, the third lumbar vertebra, fourth and fifth. So here in this diagram you can say this is the descending aorta, and ovarian artery are the branches from the descending aorta which arises at the level of the second lumbar vertebra, which is the correct option. Next MCQ is lymph nodes of ovary are drained into the following nodes, that is deep inguinal lymph nodes, the external iliac, the internal iliac, para-aortic lymph nodes and superficial inguinal lymph nodes. So always remember that from where the artery originates, its lymph nodes will go to that area. So the ovarian artery is the branch of the descending aorta, so the lymph nodes will go to the para-aortic lymph node, and this is the correct option. Next is interstitial cells of Leydig have an important function in male gametes production. Because of this function, which of the following organelle is abundant within these cells? So as we know that the interstitial cells of Leydig, they are the steroid secreting, they secrete the testosterone, which is a steroid hormone, and for the steroid hormone, these are the different organelles, and for steroid synthesis, we require large amount of the smooth endoplasmic reticulum. So here you can see this is the electron micrographic picture of the Leydig cells, in which you can see large amount of the smooth endoplasmic reticulum is present, small number of the Golgi complexes, some lysosomes over here, some lipid granules are also present, and in the insert you can see large number of the smooth endoplasmic reticulum, which is required for the steroid synthesis, and this is the correct option. Next MCQ is fimbriae of the uterine tubes are closely related to cervix, ovaries, ureters, uterus, vagina. Very simple question. Obviously, fimbriae of the uterine tube, they are related to the ovary. So B is the correct option. Next MCQ is perimetrium is outermost layer of the corpus luteum, the ovarian follicle, the ovaries, the uterus and the vagina. So we all know that perimetrium, the uterus is formed by the three layers, the endometrium, the myometrium and the perimetrium. So perimetrium is the outermost layer of the uterus, and D is the correct option. Next MCQ is epithelium of vagina is simple columnar, simple cuboidal, simple squamous, stratified squamous, cornified, stratified squamous, non-cornified. So here is the diagram. Here you can see the epithelium of the vagina, and thickness of the epithelium shows you that it is the stratified. Similarly, the surface cells are squamous in shape and it is non-keratinized. So stratified squamous, non-keratinized or non-cornified is the answer, and it is the correct option. So the next MCQ is that what are the morphological differences between corpus albicans and atretic follicles? The corpus albicans is formed after corpus luteum stops producing hormone. The atretic follicle is formed after the corpus luteum stops producing hormone. Corpus albicans is formed before corpus luteum stops producing hormone. The follicular atresia occurs in all developing follicles. The corpus albicans have a glassy appearance. So please remember, first of all, the important point that follicular atresia do not occur in all of the developing follicle. Some of the follicle are recruited and they continue to grow and they become the Graafian follicle. The first point. The second point, important point, is when corpus luteum is formed after the ovulation, it will maintain the secrete the progesterone hormone. When corpus luteum stops producing the hormone, it will become the corpus albicans. So this is the option. This one is the correct option. Next is female pelvis with respect to spine is tilted either anti-flex or backward or forward or inverted. So correct option over here is the forward tilted. Next is 18-year-old girl came to medical OPD with the complaints of the constipation and fatigue for last 8 months. She has developed piles due to constipation. What would you expect in her neurological examination? So these are the different options: the absent reflexes, the exaggerated reflexes, the normal reflexes, and slow reflexes. So please remember, piles has nothing to do with the neurological symptoms or neurological examination, and these piles develop because of the constipation. So she will present with the normal reflexes. This is just a confusing question. Next is source of estrogen in the pregnant lady is the corpus luteum, the ovaries, the placenta, ovaries and placenta, placenta and uterus. So please remember, the corpus luteum secrete the progesterone, ovaries also secrete the estrogen, as well as the placenta. Major amount of the estrogen is produced by placenta, but a small amount is also produced by ovary. So here the correct option becomes the ovaries and placenta both. So C is the correct option. Next is it is essential to have a normal epithelium of the fallopian tube in order to transport fertilized ovum to the uterus. So what are the essential cellular component of this type of the epithelium? The columnar cell with stereocilia and the PEG cells, the columnar ciliated cells and PEG cells, goblet cells, secretory PEG cells, the granulosa, theca and PEG cells, ciliated and secretory cells. So here is the epithelium. This one is the fimbriated end of the fallopian tube, and here you can see the epithelium. Two types of cells are basically present. One are the columnar ciliated cells and other are secretory cells, also called the PEG cells. So the two types of the cells are present, that is columnar ciliated cells and PEG cells. There are not the stereocilia, these are actually ciliated cells. So correct option over here is the B. Next is in lactating women, the breastfeeding inhibits the secretion of FSH and LH. The oxytocin causes contraction of myoepithelial cell. Oxytocin is essential for milk ejection. Prolactin causes secretion of milk, all of the above. So all of these options are correct. So E is the correct option. Which part of the broad ligament surrounds the fallopian tube? That will be mesosalpinx, mesogastrium, mesovarium, none of above or round ligament. So very simple question. The mesosalpinx is the part of the broad ligament by which the fallopian tubes are surrounded. So A is the correct option. Estrogen is a female sex hormone. At puberty, the estrogen causes what? Changes of the vaginal stratified squamous epithelium to cuboidal? No. Epithelium to node changes. Decreased development of mons pubis? No, because the mons pubis actually develop under effect of the estrogen. There is increase in size of the ovary, yes, because of the estrogen hormone, the different follicles are recruited and they starts to develop and size of the ovaries increases. There is regression in uterus, no, and reverse peristalsis in fallopian tube. Again, this is the wrong option. So increase in size of the ovary is the correct option. Which form the pelvic diaphragm? Very simple question. The coccygeal ligament, deep perineal muscle, levator ani, sphincter urethrae are superficial perineal muscle. So the levator ani is the muscle which forms the pelvic diaphragm. Next is the testosterone is the male sex hormone. Effect of the testosterone includes what? Atrophy of the vocal cords? No, it do not causes atrophy. Decreased development of the subcutaneous tissue? Yes, it causes decreased development of subcutaneous tissue. Decreased thickness of skin? No. Increased rate of secretion of the sebaceous gland? Yes, it is true, because it causes the increased secretion of the sebaceous gland. So you may have noticed the acne in the young adults, young males. More growth of hair on scalp? Again, it is false, because it causes even receding of the anterior hairline and the decreased growth and thinning of the hair. So this was the question taken from the exam from the different internal exams of different medical colleges. So I have included this in your lecture, because both two options, the B and D, are correct. So which of the following is common between Sertoli and the Leydig cell? They are stimulated by FSH. Remember, Sertoli cells are stimulated by FSH and the Leydig cells are stimulated by LH. Then they secrete a large amount of the estrogen. No, the Leydig cells secrete the testosterone. They secrete a large amount of the testosterone. Yes, Leydig cells secrete testosterone, but Sertoli cells do not secrete testosterone. In addition, the Sertoli cell even secrete the androgen binding proteins and inhibin. So in this case, again, none of the above option is correct. Next is secretion of androgen by Leydig cell is stimulated. Very simple question. Leydig cell is stimulated by LH. An ovary may be palpated through posterior fornix of vagina, which is situated in base of the bladder, the pelvic brain, the pouch of Douglas, the rectovesical pouch and vesico-uterine pouch. So this is the pouch of the Douglas where the ovaries are usually located and where we can palpate it. So correct option is the C. Within the male reproductive tract, the stereocilia project from the cells lining which of the following region? Efferent ductules, these are the stereocilia, remember. So efferent ductules, they are lined by the columnar ciliated epithelium. Epididymis, yes, it is lined by the pseudostratified epithelium with the stereocilia. Penile urethra, no need of stereocilia. Rete testes, there are the simple, only the Sertoli cells are present. The seminiferous tubules have specialized stratified type of epithelium without stereocilia. So correct option over here is the epididymis. An androgen that is more powerful than the testosterone, obviously it is dihydrotestosterone, which is active form of the testosterone, and testosterone is converted into dihydrotestosterone and it is more potent. Then a 39-year-old man undergoing an extensive series of tests for the infertility is found to have a genetic mutation preventing formation of the functional synaptonemal complexes during meiosis. So remember, this line is very important. It is causing almost complete failure of the sperm formation. Which cells would be directly affected by this mutation? The cells undergoing the spermiogenesis, the primary spermatocytes, the secondary spermatocytes, the spermatotids, or the spermatoconia. So as I have told you, the functional synaptonemal complexes during meiosis, they are formed between the cells which are the primary spermatocytes. So here in this diagram you can see type A and type B dog spermatogonia are present, and here you can see the primary spermatocyte which are attached to each other and which are having the primary synaptonemal complexes and which have started the meiosis. So this primary spermatocyte is the correct option. Which of the following is most potent estrogen? Again, very important question in part first examination. The estrone, estriol, 16-alpha glucuronide are none of above. So correct option is estradiol. This is the active and most potent form of the estrogen. After several years of infertility, a female seek consultation. On examination, a bicornuate uterus was found. This anomaly is due to the fusion of the two uterus with the two vagina, fusion of two uterus with one vagina, fusion of one uterus with two vagina, septas are the rudimentary horn with the one uterus. So remember the two paramesonephric ducts. These two paramesonephric ducts fuses and they form normally the single cavity of the uterus. If there is fusion of the paramesonephric ducts, it will lead to two separate uterus which will meet one vagina, and this anomaly is called the bicornuate uterus. So in this case, option 2 is correct. That is fusion of the two uterus with the vagina. Either the correct option may be the two paramesonephric ducts which do not fuses, which develop separately and open separately into the vagina. The proacrosomal granules in the sperms are derived from the mitochondria, the smooth endoplasmic reticulum, the rough endoplasmic reticulum, the Golgi apparatus, and the lysosome. So very important and very easy question. The proacrosomal granules are formed from the Golgi apparatus, and this is correct option. Next is junctional complexes forming the blood testis barrier is formed. This is again very important question from your exams as well as in the part first exam as well. So junctional complexes form between either Leydig cell, the Sertoli cell, the spermatogonial cells, type A dark cells, type A pale cell. So here have a look at this diagram. Here you can see these are the Sertoli cells which are supportive cells in the testicular epithelium, and these are the cells which are present in different phases of development. These are the spermatogonial cells, and here you can see these are the tight junctional complexes which are present between two Sertoli cells, and this tight junctional complex is basis for the blood testis barrier. So correct option over here is Sertoli cell. Next is source of estrogen in third trimester of the pregnancy is corpus luteum, the fetal adrenal gland, the fetal liver, placenta, the placenta itself, the maternal adrenal and the fetal liver, and none of above. So major amount is produced by the placenta, that is the source of estrogen, but a small amount are also produced by the fetal adrenal and the liver. So this is the correct option. The corpus luteum is maintained for the first 10 weeks of the pregnancy by estrogen, by human chorionic gonadotrophin, by luteinizing hormone, progesterone, or both B and D means progesterone and HCG. So corpus luteum is maintained by the HCG, the human chorionic gonadotrophin hormone maintains the corpus luteum, and this corpus luteum then secretes progesterone. So B is the correct option. This is all. Very good luck for your exam and Allah Hafiz till the next class.